السلام عليكم ورحمة الله وبركاته. طلاب المرحلة الخامسة كلية الطب جامعة ميسان، معكم دكتور حيدر قاسم, consultant physician, medical oncology, and our lecture today about transfusion therapy. So, learning object, donor recipient safety, antigen and blood product compatibility, characteristic of selected blood component, indication for transfusion, selected blood component, complication of transfusion, transfusion alternative, and therapeutic apheresis. Donor safety. واحد يريد يعطي دم، شنو مميزاته؟ Weight more than 50 kg, age should be 17th up to 70, regular donor should be regular donor, 17th up to 66 new donor, hemoglobin should be more than 12 in female, more than 13 in male, donation frequency normally 16 weeks minimum 12 weeks. يعني الواحد يريد يعطي دم بين فترة وفترة، أقل فترة ممكن هي 3 أشهر. Donation volume should be around 400 to 500 cc per session. Exclusion criteria: donor safety, pregnant and lactated women, known cardiovascular diseases like hypertension, ischemic heart diseases, significant respiratory disorder, bronchial asthma, COPD, on medications, epilepsy and other central nervous system disorders, gastrointestinal disorder with impaired absorption, like those with celiac disease, malabsorption syndrome, and having significant weight loss, insulin-dependent diabetes, chronic renal failure, including those on regular dialysis, those returning to occupational such as driving bus, سائق حافلة, plane أو سائق طيارة أو قطار, heavy machine or crane operator, دول سواق المركبات الثقيلة, and mining المناجم and scaffolding, دول اللي جماعة اللي يطيرون يعني الغوص في الجو. recipient safety واحد يريد ياخذ دم، شنو ميزاته؟ شو نسوي له؟ stringed arm cleansing، لازم تكون مكان اعطاء الدم نظيف. diversion of first 20 to 30 cc of blood collected، اول 20-30 cc من الدم اللي نريد نعطيه لازم يعني نخليه out giving set، يذبه خارج الجهاز. leukodepletion of cellular product، يفضل نعطيه باكت ار بي سي قليل او ما بي وايت بي سي من سبب رياكشن كلها من عندها. post collection viral inactivation steps، الدم اللي نعطيه لازم يكون مفحوص بصورة دقيقة. monitoring and testing for bacterial contamination is very important and is very rare nowadays because usually the process is sterile from the A to Z. pathogen inactivation using saline technology, this used to sterilize the giving set and bag. Safest possible source of donor for plasma based product. So you should select patient properly. Next, APO typing, as you know, blood group A, it means erythrocyte plus antigen, anti-A serum, erythrocyte plus anti-B serum 0, so antibody in the patient serum is antibody B. وكذلك للB والAB. الO erythrocyte anti serum 0, erythrocyte anti-B or A 0, so anti-B bodies are present, anti-A or anti-B antibodies in the serum. So blood product compatibility, so O whole blood, red cells fresh from the plasma, and platelet, so O can receive blood from O, red cell from O, fresh frozen plasma from OAB, AB, and platelet from all other groups. Blood group A can receive whole blood of A, red cells only of A and O, fresh frozen plasma A and AB, and platelet A and AB. Blood group B can receive blood from B blood group, red cells B and O, fresh frozen B and AB, platelet B and AB. Blood group AB can receive blood from all other blood groups AB, this is whole blood, red cells AB, ABO, fresh frozen AB, and platelet AB. So we notice from this diagram that the O can accept blood from only red cells, while AB can accept blood from all other blood groups, and O can be given to other blood groups AB, and regarding plasma, AB can be given to all other blood groups. By the way, platelet, if you have a purified platelet machine, you can give a platelet without needing blood group. This is a very important issue. Blood component prescription and transfusion record. Whenever you want to decide to give blood for a patient, the patient should be inpatient and should be monitored by both doctors and nurse, and you should have a recording paper for blood transfusion, and these records should be filled by both doctors and nurse, and the doctors usually this job of resident. So this is an example for National Health System from King's College Hospital. Blood component prescription and transfusion record: gender, hospital number, surname, foreign name, date of birth, ward, gender, patient blood group, continues, any other special product required, diuretics for transfusion, usually use diuretic transfusion in patients with volume overload, that those with heart failure, renal failure. History of transfusion reaction should be mentioned. I would like to be given with transfusion should be mentioned also, and answer no or yes, no or yes. Specify and describe on drug chart should be all these information should be filled. Date to be given, product, whole blood, fresh frozen plasma, packed RBC, rate of duration, very important. As you know, all the blood component, not all the blood, let us say packed RBC, the suitable time is between 2 to 4 hours. The suitable time to be infused within. Doctor name and bleep number. As you know, all the doctors having bleep. If there is something wrong with this patient, you can alert the doctors, which is not present at time of transfusion. Please sign and print should be documented. Serial number of component and expiry date is very important. You should compare the serial number on the bottle and on the paper you ask for blood transfusion should be compatible, and these are fixed by label. Nurse doctor name put up by and checked by. You should mention the name of the nurse and doctors, and please signature and print, very important. Observation, temperature, pulse rate, respiratory rate, blood pressure must be recorded pre-transfusion, then temperature, pulse 15 minutes, and hourly during transfusion, then temperature, pulse, respiratory, blood pressure post transfusion within 1 hour. So any patient taking blood, you should keep this patient at least 1 hour post the end of blood transfusion and check his vital signs. And please document the time each set of observation are taken. This should be why this chart? You notice this is complicated chart? No, because the blood transfusion reaction are serious reaction, and we lost patient during transfusion because of the side effect of blood transfusion. So this is very important issue. The drug should be given in hospital exclusively and should be followed restrictively from medical staff, whether nurse or doctor, and this chart should be filled according to the information given with it. Characteristic of selected blood component: whole blood. ماذا نقصد بwhole blood? Volume is 400 to 500. hematocrit or platelet count about 35 to 45. Half-life 35 days. Donor per unit 1. Storage 2 to 6. Content RBC large amount of plasma, platelet or white BC. Increase hemoglobin 1 gram or hematocrit 3%. So whole blood can be kept for 35 days. What about packed RBC or red cell? Red cell, usually the volume of red cell is 250 rather than 350. Hematocrit 55 up to 70 count. Half-life 35, the same, up to 42, depend on the anticoagulant agent put in the bag. Donor usually 1 unit, storage 2 to 6, content RBC with a small amount of plasma, about 50 cc. So it is not a pure red cells. There is a plasma about 50 cc, an increase in hemoglobin after transfusion 1 gram or hematocrit 3%. What about platelet? Platelet concentrate. Platelet concentrate, it is from 50 to 70, and hematocrit or platelet count about 9,000. The half-life is 5 days, and the donor per unit is 1 unit given as pool of 5 to 6 units. You can take up to 6 units from 1 patient. Each unit contain about 9,000 platelet, and the storage is 22. Increase in platelet count, 5,000, 0.5 up to 10,000. Contain 5,000 points. Increase platelet count up to 10,000. So platelet storage is only 5 days, short time. Single donor platelet, whenever you want to give a platelet from only one donor, about 200 to 400 cc, contain about platelet count 30,000. It kept for 5 days. Donor per unit 1, storage at 22, and content 30,000. And if you assess a platelet count after 1 hour, it can increase platelet count about 5 to 10,000. About 5 to 10,000 within 24 hours post transfusion. It depends here on creatinine clearance. Should be more or even to equal to 10. What about fresh frozen plasma? Fresh frozen plasma, it is 200 to 250, equal to RBC, packed RBC. Half-life 1 year, 24 hour when thawed, and donor 1 unit, storage 2 to 6. Plasma proteins such as coagulation factor, protein C and S, antithrombin, increased coagulation factor by 2%. Cryoprecipitate ما يسمى براسب البارد 10 to 20 ml, pool of 10 units, 200 cc, half-life 1 year, 24 hour when thawed. يعني خلال 24 ساعة ممكن تستخدمه من طلع من المكان الستورج مالته. 1 unit given as pool of 10 unit. Could cold insoluble plasma protein such as fibrinogen factor 8 and volume factor, topical fibrin glue, increase in factor 8 about 80 international units. هذا ما يسمى الراسب البارد اللي بيعتمد على vulnerable factor, factor 8, fibrinogen, and even factor 13. So this is a diagram, donor safety education of donation, whole blood 450, filter to remove the cell separator, machine cell separator, filter to remove leukocyte, red cell, pure red cell, storage 4 to 5, and this is fresh frozen plasma, -30, 12 months, 1 year, pooled platelet 22, 5 days, and should be sent, all these blood components should be sent to be tested for hepatitis B, C, HIV, HTLV, syphilis, and even other bacterial infection like toxoplasmosis, parasitic infection, other word like UK. Okay. So indication of blood transfusion: whole blood, hypovolemic, massive transfusion, exchange transfusion, red cell increase auto carrying capacity in symptomatic patients. So it should be symptomatic. It should be symptomatic. Indication of platelet transfusion: if the platelet is below 10,000, all patient, even asymptomatic risk of spontaneous bleeding is very high. Below 20, coagulation disorder or minor bleeding. Below 50, patient having major bleeding or surgical, undergo surgical procedure. Non-functioning platelet, acquired or inherited defect like Glanzmann's thrombocythemia and Bernard-Soiler disease. We stop here and continue on the next part of the lecture. Thank you very much.